Morning you guys, it's Karen and I'm here to talk about Watson's cancer story. I did think about doing this video and then I actually had a request to do it, so I'm going to try and give you as much information as I can. How we found the cancer, how it was diagnosed, what the costs involved are and were, and what the end result has been. The first thing that happened was we found a very small lump on Watson's, sort of on his underarm, but on the outside of his underarm, so you could see it when looking at him from the side, and it was just a tiny little lump.
So inoffensive, that's it there. Such an inoffensive lump, isn't it?
So at one of our appointments, because we go to the vet quite often because Watson gets allergy injections and whatnot, the vet had a look and said it just looks like a histiocytoma. A histiocytoma is it is a tumour, but it's a benign tumour, and he's actually had one on his lip that just went away with antibiotics. It became infected and went away with antibiotics, and nothing was ever done about it. So they said it looks like a histiocytoma, it doesn't look like anything to worry about, so we'll just watch and wait. Over the following months, my husband and I would occasionally comment to each other, do you think that lump's got bigger? And we'd both been unsure as to whether we were just imagining it, because it wasn't such a big jump that it was obvious. You know, we were both like, oh, I don't know, I was thinking it was maybe a bit bigger yesterday, but now it doesn't seem to be, and I'm not sure if I imagined it, and we both kind of felt the same. However, in December, at the beginning of December, it suddenly got a lot bigger. And so, again, while I was at one of his routine appointments, which I had a couple of days after noticing it had got bigger, I mentioned it to the vet. Now, by the time we got to the vet, 2 days later, it had shrunk down again and was small. So we mentioned it to the vet and he said he would do what's called a fine needle aspirate, an FNA, and this is a term that you will be very familiar with if your dog has had any lumps at all, or if they get any lumps. The first thing they want to do, if possible, is a fine needle aspirate. So what that does is it takes cells from within the lump, and that can tell you much more than any x-rays or scans, and also they don't want to take it off as in a biopsy, because if it does turn out to be cancer, they want to do one surgery where they would take margins, meaning they would take an extra area around it to make sure they'd got all the cancer. So this guy did the fine needle aspirate, and what I noticed was I was saying to him that the lump had got bigger and then got smaller, and he sort of repeated that back to me, and he said, oh, so the lump gets smaller, then gets bigger, then gets smaller, then gets bigger. And I said yes, and he went okay. And I think he knew at that moment that it was a mast cell tumour. Obviously he didn't say, but that's actually how a mast cell tumour behaves. It will get bigger, then get smaller, then get bigger, then get smaller, and it was normally the size of a pea, but when we noticed it definitely getting bigger, it was about the size of a blueberry, or maybe even a grape, probably somewhere in between a blueberry and a grape. So he took slides. The way that he did that, or he took a fine needle aspirate, was they just push a needle into the lump, and he did it actually about 6 times, and it looked quite uncomfortable. Watson's very, very good at the vet, but they move the needle around and try to take cells out, and they put them on slides. So he did 6 slides, and I've got the bill here, and I'm just trying to find the actual bit, because we paid for his cytopoint injection for his allergies, and we got some of his repeat medication, but the consultation was £30, and the cytology, so it says 6 slides, was £67.99. Now there's a 10% discount on that, so that's because we pay their Healthy Pet Club, so we pay a monthly amount of £12 which gives us a 10% discount on veterinary fees. So it would cost you about £100 all in all from the consultation and the slide. So that was the 21st of December. At that point, we didn't think it was anything serious at all, and we knew that we'd get a call after Christmas, because like I said, it was the 21st of December and the labs were going to be closed, and you know, they tend to take about a week anyway, so we just kind of put it to the back of our minds. But I came home on the day after Boxing Day. I had been out shopping, and I came in and was chatting away to Kev, and he said, Watson's got an MCT, and I was like, a what has he got? And he said he's got a mast cell tumour, and that was us both in floods of tears. So he had got a call while I was out to say that it had come back as showing that it was actually a cancerous tumour. So those of you with pets know how upsetting this is and how worrying it is, and you know, I'm trying to keep my mind off it, but it's really, really hard. It's hard not to think the worst, because until we know what stage this is, we don't know what's going to happen. I'm going to put this update on his Instagram channel, on Watson the Labradoodle. That was the 27th. We had an appointment on the 28th to go in, and the idea was to try and sample Watson's lymph nodes to find out immediately if it had spread to his local lymph nodes, because with a mast cell tumour it can be either a grade 1, a grade 2 or a grade 3. There is now a new system that just makes it grade 1 or 2, but the system they were using is grade 1, grade 2 or grade 3. Grade 1 mast cell tumour is just local and can be removed with surgery as long as you get clean margins, so you get all of the cancer in that area. Grade 3 is very aggressive and has almost always spread, so it will have spread to different places. The first place it goes is to the lymph, then it goes to the spleen and the liver, and it can sometimes go to the chest, very rarely the lungs. Grade 2, and I know I went through them in a different order, but grade 2 either acts like a grade 3 or it acts like a grade 1. So it's quite frustrating to have that sort of crazy scale that doesn't really make sense. Anyway, the first thing they were trying to check was, has it gone to his lymph nodes? That's a fairly easy test that would tell us if it's spread, and we could maybe decide what type of tumour it is. Unfortunately, they couldn't find his lymph nodes, which the vet said to me at that point was really good. She said it means they're not enlarged, and that's a good thing. I at that point was asking, you know, when do we go to the cancer centre? I don't understand why, even now, why we weren't referred at that point. He has cancer, why are we not referred straight away to go there, and he could have had his surgery there? I actually, now looking back, would have been more comfortable with that. And I would say to you, from my experiences with Watson, for two specific things, I would say go to your specialist cancer centre if at all possible, and ask if you can be referred there and have the surgery done and the test done at the cancer centre, because firstly they are the specialists, and that is really important. Vets are just, you know, they've got to know so much about so many different breeds and so many different specialities, and they're not specialists, so they're more like a GP, but they have more to do. But also at the cancer centre you'll tend to get results quicker, and we didn't realise that until recently going to the cancer centre. So what she said, the vet said, because we couldn't get to his lymph nodes to test them, that we would go straight to surgery, and the lump would be removed with margins. The margins were 2 centimetres, so the lump was only very small, about the size of my fingernail at that time, and she would take 2 centimetres around it. It didn't sound that big, 2 centimetres either side, so it's going to be 5 centimetres. That's what we thought. And she said, prepare to see a very big wound when he comes out of surgery, because of the margins and the area that it's in. She's going to have to take a big amount of tissue. So we booked his operation. This is on the 28th of January. We're there. We couldn't book the operation until Monday the 7th of January because the practice was closed for the new year, and especially in Scotland, even the 2nd's a holiday, and it was full on the Thursday, Friday, so we had to wait an agonising week until he got his surgery. So on the day of surgery, he couldn't have anything to eat the night before, after 8 o'clock. We took him in. It was horrible leaving him there. That's the worst part. My husband took him in. I didn't take him in because I didn't want him to feel my anxiety. And then we were allowed to pick him up at 5 o'clock, no earlier. When we picked him up, he was happy to see us, but he was clearly out of it. He had obviously general anaesthetic, but he'd also had methadone, which I was surprised I didn't actually know that was used. I thought that was only used for heroin addicts as a kind of withdrawal thing, but it's actually used as a very good painkiller for dogs, or for people as well. So he was very, very out of it, and the wound was huge. We were very surprised, quite scared by it. It had a drain in it, because apparently what had happened is she'd had to remove muscle and fat from the area in order to get all of the cancer out, and that left what's called a dead space, and so that could collect fluid, and so there was a drain in to enable the fluid to come out.
Yeah, a little stretch there, Bubba. Here's my baby boy. As you can see, he's completely out of it. And I would be too if I had a wound that size.
The bill that we paid on that day was £1,100. But while Watson was having his surgery, we had said, can you also do an x-ray of his hips? Because as you may remember, Watson had hip dysplasia, but it's a bit of a complicated journey in that he had an x-ray. We were told it was hip dysplasia, but that we needed to send the x-ray to a specialist. At the time we had both lost our jobs and couldn't afford it, so we waited, and actually a year later when we were earning money again, we sent it off to a specialist, and they said that the x-ray hadn't been done right. It did look like he had hip dysplasia, but they couldn't confirm because the x-ray hadn't been done right and that we needed it done again. Watson's hip hasn't been too bad over that period, hadn't been too bad, so we didn't want to just send him for an x-ray and sedation for no reason. And so because he was going under general anaesthetic for this surgery, we said, you know what, we'll have his x-rays, his hips x-rayed at the same time. That was part of the cost. So the cost, the 1,100 covered the surgery and all of the general anaesthetic and all of the drugs surrounding that, and we were given tramadol to take away. We were given, I think, 3 days worth of tramadol. It covered an x-ray of his hips, and it also covered an ultrasound of his abdomen, which they did while he was under, again to see if they could see anything, see any spread, any other tumours. So I imagine, I think the x-ray would probably be a couple of £100. And then there was a specialist report in that. So I think it would probably cost £800 for the surgery. And all the follow-ups after that were free. That was all included in the £800. Every follow-up was free. The only thing we paid for is we went back in a week and we needed more tramadol because he was still in pain, and there was a suspicion that there was a slight infection, so we got some antibiotics and we had to pay for them, and I think that was about £50 total. Yeah, £30 here for the Sinuclav, which is the antibiotics. So Watson recovered really well. The first night was horrendous. He was restless all through the night and crying, could barely walk. You know, we tried to get him to go outside to the bathroom. He'd stand up, he'd go to walk, but you could see he was in too much pain. So it was really hard for us, really hard. But he recovered pretty quickly, because we do know another dog that's had mast cell tumours removed with the same kind of wound, and he wasn't walking for 4 or 5 days, whereas day 2, so we took him in on the Monday for the surgery. On the Tuesday he wasn't walking in the morning, and all of a sudden he got up and was like, let's go out. I couldn't believe it, and he went out. He wasn't running around or anything. The drain was dripping everywhere, so that was kind of difficult, because although we've got mostly wooden floors, there was drips of blood, sort of bloody fluid all over the bedclothes. What we did was moved our mattress into the living room and put it on the floor. It served a couple of purposes. It meant that we could stay with Watson all night and he didn't have to get on the bed. Watson doesn't get on the bed anyway. We'd want him to, but he just isn't interested. But he did seem to want to be near us, and so we were able to be right next to him all night. But also, because we put the mattress against the sofas, it meant there was no bed for him to jump on, and it meant there was no sofas. Well, the sofas were there, but it wasn't a big jump, because the idea was he wasn't to jump or, you know, stretch out too much because of the stitches. He does jump on our bed, but only when we're not in it. I know that's really strange. They're not supposed to have walks actually in the first week. We got a bit of conflicted information on this. I had been taking him for walks. As soon as he was able to go for walks, I had been taking him for walks. And I say walks in inverted commas. So what I was doing was I was taking him to there's a little local park that is very, very quiet with barely any other people or dogs in it. I was taking him there in the car, obviously, and then just sitting in the park and throwing treats out on the grass so that he could sniff them out and he could just sit there and get some smells. So Watson's not the type of dog that runs around when you take him for a walk anyway. He never has been. He doesn't chase a ball or anything like that.
You can see he's just enjoying it, looking about, seeing what's happening. If dogs come near, I put him on the lead and kind of try and move away, you know, and yeah, we'll just play and find it. Yeah, you got it, clever boy.
However, later on when we saw the head vet, she had actually said, I think it was about 2 or 3 weeks after the operation. And she said, oh, you can start getting him back to his normal level of activity now. And we were like, we've been doing that for a week. So we built him up very, very quickly, and it seems like it may have been too quick. And he was actually desperate for it, because I started off taking him for little walks around here, and he took me to my car and just sat there and refused to move. And so that was him saying, we need to go somewhere a bit more exciting. I'm kind of fed up with this, you know. Anyway, he recovered well. His scar has healed amazingly. Dogs are just amazing like that. They're so resilient. So, you know, if your dog is going through surgery, just remember how resilient they are, and they'll heal much quicker than you imagine. So during his recovery, we are waiting for a phone call. We still don't know at this point if the cancer has spread, and we're waiting for a phone call to confirm what the grading of the cancer is, whether it's a grade 1, grade 2 or grade 3. Obviously we hoped it would be grade 1. If it was grade 1, it would mean that it was taken away. As long as they got clean margins, that was it, no more treatment. Grade 3, we definitely need either chemo or radiation. Grade 2, we weren't really sure what would happen if it was grade 2. That was the kind of anomaly. So we got the call eventually. I kept chasing them up, and actually it took, so the operation was on the Monday. We didn't get the results, I think, until the following week, on either the Wednesday or the Thursday. It was a long wait, and it was over a week. Apparently it takes a lot longer when they're looking at tumours and margins and things, because it's a real intense process, and they have to be meticulous and go over every bit of that skin. So I got the call to say that it was grade 2, bawled my eyes out on the phone, of course. But she was saying to me on the phone, the vet was saying to me that she's still very positive about it. And I didn't really understand what she meant. Well, how could she be positive? It was grade 2. We didn't know if it would spread. But she told me that it was now time to be referred to the oncologist and to go to the cancer centre. So we were then to wait for an appointment. I then took the time to research into mast cell tumours more than I already had. I had done some research, but not as much as I perhaps needed. I had a look at and bought an article which is from the British Veterinary Association on the protocol for how to treat mast cell tumours. And actually I did go back into the vet. I had another appointment at the vet before going to the cancer centre, and I went in there kind of armed with all my information, and I went in and I said, I think he should have his lymph nodes checked, because although you can't find them and they're fine, they've never been checked, and that's the first place the cancer goes. And I said I'd also like to have a test to see what his mitotic index is. Mitotic index is just something that tells you if this is the type of cancer that spreads, basically. It gives you an idea. And this is where actually my medical knowledge from humans and from human cancer really came in useful when I was reading the protocol and the information. But as it happened at that appointment, she said yes, she totally agrees, and that's what would happen at the cancer centre. He'd have his lymph nodes checked, and that they had done testing on the tumour, and the mitotic index was 0. As soon as I knew that the mitotic index was 0, that was like a huge sigh of relief for me, because that meant that the tumour was behaving like a grade 1. Not like a grade 3. Do you remember I said the grade 2 behaves either like a 1 or a 3, which is why it's ridiculous to have a 1, 2 and 3. It just needs to be either 1 or 2. So completely relieved by that, but now just eager to get to the cancer centre, get everything tested, and, you know, confirm that it hadn't spread anywhere. The cancer centre actually phoned me and said, and gave me an appointment, which was, what date are we today? 7th. So it was the 5th of February, it was 2 days ago. And they said that not to worry, that it was quite a while away, because it was a week and a half away from when they phoned me, that because his mitotic index was low, they didn't believe that it was likely to have spread. So this was just a protocol. It was belt and braces approach, because in grade 1 tumours, 80% of them don't spread, but 20% do. This was looking like a grade 1, and so there was only a 20% chance that it had spread. So we had our appointment 2 days ago. We went to the cancer centre. They were absolutely amazing. It's a completely different experience going to an oncologist with Watson than having it dealt with at the vet, because they are specialists and they know that this is an awful situation and they understand how you feel. And she came into the waiting room, said hello to Watson before saying hello to us, which I liked that, that gave me comfort. Then she introduced herself. She had a student with her, because it's a teaching hospital the one we went to, and took us into a big room. We let him off lead, let him have a sniff about, and she just chatted to us. And she asked for a full background. She wanted to know everything about Watson. So our appointment was at 9:30, and the plan was basically it takes up the whole day and everything's done in one day. I imagine it's the same at most cancer centres. So you get your consultation, they do some checks, and then you leave him there and he gets all the scans he needs. So she talked us through exactly what mast cell tumours were, that they're the most common type of cancer, that, you know, when they spread, when they don't. She just gave us a whole lot of information about it. We gave her a whole lot of information about Watson, and then she explained exactly which tests they could do, and talked money, basically, because at that point she said she'd noticed that Watson had skin allergies, and she knows how expensive Apoquel is. He's on Apoquel, and she said she just wanted to make sure that which tests we wanted, how much we had left in our insurance plan, if you like, or if we didn't have insurance, how much we had to spend. And so that was quite good, because they're very aware of the money, and she said she'd been looking at it, how could she get the most tests for the least amount of money. But we were able to say that we had a good allowance left, because we've taken a PET plan policy. PET plan are the only company that do not increase their renewal rate in relation to claims. They will increase every year due to age and just due to inflation, but they are the only pet insurance company in the UK that do not increase in relation to claims. Meaning, if I got another dog that was the same breed, the same age as Watson, the premiums would be exactly the same as Watson's, regardless of the fact that Watson we claim every couple of months. We're surprised we're not blacklisted. We thankfully had taken the middle level of cover. You could either get 5,000, 7,000 or 12,000. We'd taken 7,000 on a covered for life, so we stay with them for life, and we have that cover for life. And so I had to work out how much of that we had spent on skin allergies and all of the other things that he's had, because Watson has had Campylobacter poisoning, where we had a couple of emergency visits, and they're like £300-400 each. So, you know, I worked it all out, and we had spent about £5,000 and claimed and been paid by Pet Plan about £5,000 less, of course, the excess for each condition. So we've probably paid about £500 a year in excess charges. It's £100 per condition. So I said to her, we have got £2,000 left with Pet Plan still to spend, and I said, but regardless of that, we'll have all of the tests. I said, just do everything, and if we have to pay the rest ourselves, put it on a credit card, whatever, because I had no clue how much it was going to cost. And she said, oh, that £2,000 will easily cover it. And so the quote we got at that point was £900. That £900 was for so much, I couldn't believe it. I would expect this to cost a lot more. It was for another ultrasound of his abdomen. And like I said, I'll talk about why you should go to the cancer centre at the end. An ultrasound of his abdomen, and then a guided ultrasound of his lymph nodes, where they would use the ultrasound to find his lymph nodes and then remove some cells. The same thing for the spleen and liver. They would use the ultrasound to guide them and take cells from the liver and spleen. A chest x-ray, and I think that was everything. Yes, I think that was everything. And what she explained to us was that cancer is not most visible on scans, nor is it most visible in blood work. And I should have said, actually, he did have blood taken when he had his surgery, and so we didn't need to repeat bloods at the cancer centre. But she said it's very rare that you find cancer on a scan or in blood. You mostly find the information you need in the cells that are taken. I thought that was particularly interesting, because I had always thought that scans would give you the best idea of tumours. And I suppose when I worked in medical research and worked with oncology in humans, there were certain scans that were the best way. PET scans were the best way to find out if there was any spread of cancer. So that was really interesting to find out. So at that point, we left Watson at the cancer centre, and that was about 10:30, so we were there about an hour, and then we left him, and she said we could probably pick him up between 2 and 3, but she would call us when he was coming round and ready to be collected. So we went and had a coffee and did a few chores, and Then we got a call. We decided to just go back and be there for about 2 o'clock, just so that we were there when he woke up. And we got a call when we were literally 5 minutes away. So I was glad we'd made that decision to say we could get him. We went in and he was there. He was very distressed, actually. Desperate to leave. He was crying and he was jumping all over us and then going to the door like, come on, let's get out of here. So he obviously, I mean, not that you'd expect him to enjoy his experience, but he didn't want to be there anymore. He was like, let's go, I've had enough. And he'd loved the nurse or the oncologist at first, but now he was like, let's get out of here. I suppose because he felt weird, you know. So at that point, she told us that on the scans, she could see nothing. There was nothing at all. And in fact, she told us that Watson had gone into the lead oncologist's office, jumped on his lap and given him a cuddle. And the lead oncologist had then taken Watson to have his scans and told the sonographers, right, I don't want to see anything on these scans. Do not find anything. I want really boring scans. So that was really sweet. I cannot tell you how amazing they are at the centre. It's just so much easier having people that know what you're going through, and they sort of have adjusted their emotional level almost because of that. You know, there's nothing routine about it. They're so friendly. They're so lovely. So anyway, she told us there was nothing on the scans, so what we needed to wait for was the cytology results, which is the cells that were taken from the spleen, the liver and the lymph nodes. The only thing she had seen was that his lymph nodes were enlarged, so of course we were then concerned. She said it could be from surgery, but obviously we won't know until the results are back. We then expected to wait another week and a half because that's how long it took for the other cytology from the tumour. But she said the results would be ready the following day because it was all part of the cancer centre. It was on site. They were having the labs done. And she said, in fact, if you don't get a call by 3 o'clock tomorrow, phone me and I will run over and chase them. So, you know, again, they understand the urgency. They understand that you're sitting waiting for the phone to ring. They phoned at about 12 o'clock and she said that they can see nothing at all in any of the cells. There is no spread. And so that's us at the end of the journey for now. He needs no further treatment. He is at risk of getting them again. And apparently 30% of dogs that have a mast cell tumour will get another one. It's not a recurrence. This one is gone. This one is done. The chances are 30% that he will get another mast cell tumour. And it doesn't mean because this one was grade 2, the next one would be grade 2, the next one could be grade 1 or grade 3. And she actually told us about a dog that she's treating that's had 10 mast cell tumours in 2 years. We have a friend that has had 4 mast cell tumours in 2 years, but has now been, I think it's a year without any. So that is a bit scary, obviously, you know, knowing that this could come back. But what it means is we just need to be vigilant on checking his body. And I'm going to do that daily, you know, check for lumps. And if any lump appears of any kind, we get it aspirated immediately. Now, the cancer centre will check up on him, or offered this, we don't have to take it, but we'll check up on him every 3 months for the next year and then every 6 months for the 2 years after that. And so we've accepted that. We're more than happy to go back to the cancer centre every 3 months. And she also said, if you come across any lump that needs to be aspirated, they're happy for us to go to the cancer centre and have it done there versus going to the vet. Yeah, so we will definitely, if we find any lump at all, the first thing we will do is make an appointment with the cancer centre because they are the specialists. It's very difficult to do a fine needle aspiration, although apparently it's easier with mast cell tumours. But we'll get the results within a day versus waiting a week and a half if we go to our own vet. The 3-month follow-ups are £50 each time. So even if we didn't have insurance, we would be able to afford that. So, yeah, he is now cancer-free. There is no trace of it in him. And ironically, he is healthier now than he was before the surgery. So that's where I said I was going to tell you why I think that you should go immediately, as soon as you can, to a cancer centre and ask to be referred. Because one of the things the oncologist that we saw at the cancer centre said was, we can repeat the ultrasound abdomen if you like, but she said that's not essential. She said your vet did an ultrasound whilst they were having surgery. And I said to her, well, I've got 2 reasons that I really would like that repeated. I said, number 1, the vet said to us, I did an ultrasound during surgery and I can't see anything. She said, but I'm not a sonographer, an ultrasonographer. So she's not a specialist in the field of ultrasounds. And so that makes sense to me, that have it done by ultrasonographers that work at the cancer centre. The second reason was, do you remember I said that the x-ray was taken at the vet of Watson's hip dysplasia, or of Watson's hip, whilst he was having another lump removed, actually, which turned out to be benign. He had an x-ray of his hip. A year later, we sent it to a specialist who said the x-ray wasn't done right. So that in itself is again proof that the vets are not specialists. Yes, they can do an x-ray, but they are not radiologists, they're not technicians, they don't know 100% how to put him in the right position. And after that initial x-ray, Watson was very distressed and in pain for a few days afterwards, and that possibly is because the x-ray was done wrong. And so that's my second reason for wanting everything done at the cancer centre, because the specialists will do it, the oncologists will look at the results, the labs who are used to looking at oncology results will look at the results, the ultrasonographers will do the ultrasounds, the radiologists will look at the radiology reports, you know, the scans, the x-rays, all of the specialists will be looking at it. I think I've told you all the costs. I've told you everything. I think I haven't gone deep into like his recovery and it, you know, step by step, but like I said, he recovered well. If there's anything I've missed, anything that you want to know, then please let me know in the comments below. I'm extremely pleased, obviously. We were delighted yesterday. We're planning a holiday in a couple of months to take Watson away and just celebrate. So yeah, if you have any other questions, let me know. I'll do my best to answer it. And, you know, if ever this comes back, I will, of course, let you know. And I will be keeping him short as well. We're keeping his fur short. I'm going to groom him this weekend coming so that there's more chance of us feeling or seeing lumps, because Watson is a fluffy dog. So thank you so much for your interest. I wish you the best of luck if you are going through anything like this at all, and I will speak to you again soon.